Welcome, guys, again for another session in GI system. And guys, I think you know that we covered the gross anatomy previously in two labs, but still we have to cover the liver and the pancreas. So I will start, guys, first with the liver. You know, this is the liver, as you see, and you know, I'm not gonna repeat that much of theory, but I would like guys to know. And you see here that's the liver composed from right lobe and left lobe. Look, I indicated the right lobe, or I determine the border of right lobe from left lobe according to this landmark, which is, you know, the location of the falciform ligament. Yes, anatomically, as I mentioned, the liver divided into right lobe and left lobe by the falciform ligament. And you know, the falciform ligament divides the liver in two lobes, of course, superficially. That means this is just anatomical landmark. And maybe you know that the physiological division is the most important division. But guys, let us start with the anatomical division. And you look again to the liver, you see this is the diaphragmatic surface of the liver, including the anterior, superior part, and part of posterior part of the liver. This is the diaphragmatic surface. You can say diaphragmatic or diaphragmatic. This is depends British or American pronunciation. Anyway, so this is the diaphragmatic surface, guys, of the liver, and this is the right border or the base of the liver. And if this is the base, that means this is the apex. However, guys, let us have a look on the visceral surface of the liver. Yes, this is the visceral surface, but I would like first to show you again something here in the back. This part, guys, this structure is the inferior vena cava. This is the inferior vena cava, guys, in which it's located posteriorly. Always remember the inferior vena cava posteriorly. So it will become like easier to identify different structures and relations of the liver. So this is the inferior vena cava located posteriorly. So let us flip the liver let us flip it and have a look to the visceral surface of the liver. This is the visceral surface of the liver, in which, guys, you see kind of like fissures, impressions here and there, and different structures. I think, I'm sure, guys, you are aware of almost of these things from the theory, but let me show you here. Yes, this is the falciform ligament, and you know that the there is a ligament which is known as round ligament of the liver, or ligamentum teres, that attached to the inferior free border of the falciform ligament. So this is the round ligament of the liver. Okay, so it was, of course, umbilical vein, but after birth, there is no need for umbilical vein. So it obliterated and it becomes a round ligament to the liver. So what I want to show you here, guys, other than the round ligament of the liver anteriorly, because, you know, this is anterior and this is the, I would say, the inferior border of the liver. Guys, the anteriorly you have the round ligament, and let us continue posteriorly. You will find here another fissure, which is for a vein that was there. So there was here ductus venosus. Ductus venosus, that means a duct, it's like a vein. So it was for what? To shift the blood from the umbilical vein that was patent to the inferior vena cava directly, because the liver is not functional. So the ductus venosus here regreated, and you know, it becomes like a ligament known as ligamentum venosum. Not round ligament, it's ligamentum venosum. So this is the left sagittal plane, if you remember. This line that passes through the round ligament and ligamentum, group ligamentum venosum, is the left sagittal plane. We want to draw a shape, this one and this one. So the another right sagittal, the other sagittal plane, which is the right sagittal plane, passes from the gallbladder to the inferior vena cava. Then, so from this plane to this plane, guys, we connect both of them with the transverse, passes through something called Porta hepatis. So this is the hilum of the liver, or Porta hepatis, that contains a couple of structures. We'll talk about it. However, by this way, we create a shape, right? This is the, of course, the right and left sagittal planes, and in between there is a transverse plane here. Then we create a shape. This is to remember always, guys. Now, so we mentioned that the right sagittal plane passes through the gallbladder and inferior vena cava. Okay, so we have gallbladder. Yes, we can see here's the fundus anteriorly, the fundus of gallbladder that's in contact with the anterior abdominal wall. Yes, this is the fundus of gallbladder, this is the body, and this is the neck of gallbladder. And from the neck of gallbladder, you know, we have cystic duct. So this is the cystic duct, because the gallbladder is like a cyst, pear shape like a cyst. So this is the cystic duct. Okay, so again, on the visceral surface you have the right lobe and you have the left lobe of the liver, and you have, guys, the porta hepatis, you have gallbladder, you have inferior vena cava. But guys, before shifting talk about the porta hepatis, I would like to mention two things. First of all, the physiological division and the peritoneum that covers the liver. So you see this quadrangular lobe. This is anteriorly, right? Always remember the gallbladder anteriorly, inferior vena cava posteriorly. So anteriorly, guys, you have this quadrate lobe, مربع الشكل, anteriorly, which is between the gallbladder on the right and ligamentum teres on the left. But posteriorly, there is another lobe, which is also between the ligament and vessel. Here, it's between the ligamentum venosum and inferior vena cava, which is posteriorly, as I mentioned, it's caudate lobe. Caudate lobe. So we have anteriorly quadrate lobe, posteriorly we have caudate lobe. Both of them anatomically, because you know anatomically this is a falciform ligament, so this is the right lobe. So we consider both of them from the right lobe anatomically, but most importantly, physiologically, guys, we consider the quadrate lobe and caudate lobe part from the left lobe. Physiologically, they are part from left lobe because their blood supply, bile drainage, and arterial supply, bile drainage, and the portal venous blood drainage from the left. So physiologically, we consider them from the left. Anyway, so look at the peritoneum that covers the liver. Yes, you know that the liver covered not completely by peritoneum. That means there's an area that you know is located posteriorly against the diaphragm here. Again, this is the inferior vena cava. That means this is posteriorly. So this area that's not covered by peritoneum, known as pear area of the liver. This is the pear area of the liver. Let me show you. This is the pear area of the liver, not covered by peritoneum. So you know that the peritoneum covers these, for example, the diaphragmatic surface, not all the way. At this region, at this edge, it reflected like this. I would like to simplify it for you guys. Say, for example, this is the peritoneum. Let me remove this. Okay. So this is the peritoneum that covers the liver all the way up until it reaches this bridge. So then the peritoneum will reflect like that. Because here is the diaphragm up. So it lines the, see, this is the diaphragm. So it lines the diaphragm like that and reflected on the liver. So if you look at it here, yes. So the peritoneum covers this region of the liver, but reflected here to line the inferior surface of diaphragm that's located above it. However, this is a reflection point here. And also, the peritoneum covers the visceral surface, not completely, the visceral surface of the liver all the way until it reaches this ridge. You see this ridge? This ridge, like this again, right? So there is an area that's not, I would like, so yeah, it's almost like that, very close to this, okay? So there is an area, guys, not covered by peritoneum from the back. This is the bare area of the liver. Now, the reflection of the peritoneum at this region and the reflection of the peritoneum inferiorly, it creates a kind of something called coronary ligament. So this is the anterior layer of coronary ligament, and this is the posterior layer of coronary ligament. So, or sometimes they call it, instead of anterior layer and posterior layer, they call it superior layer and inferior layer of coronary ligament. Between them, yes, we have the pale area not covered by peritoneum, the pale area of the liver. So, where is the, let me show you the anterior layer. Started from here. Okay, let us follow the anterior layer of coronary ligament here. And this is the end of it. Now let us move to the inferior layer. Yes, it comes from here. Then, you know, here, skip the inferior vena cava. Yes, follow it here. Then this is the posterior layer. So the anterior layer and posterior layer of coronary ligament, they unite laterally on the right and on the left to form a triangular ligament. This is the right triangular ligament, and this is the left triangular ligament. Excellent. Back to the visceral surface of the liver. So again, this is posterior, and let us look to the inferior surface or the visceral surface of the liver. Yes, you have the porta hepatis, guys, and look at the structures at the porta hepatis, which is, you know, most anteriorly is the right and left hepatic duct. This is the right hepatic duct and left hepatic duct. Posterior to them you have, guys, right hepatic artery and left hepatic artery. Right and left hepatic artery. Now, posterior to the hepatic right and left hepatic artery, you have, guys, the right, of course, and left portal branch of portal vein. This is the right branch and this is the left branch of portal vein. So the portal vein most posteriorly. So again to the biliary system, guys, gallbladder, as I mentioned, fundus body, next, and cystic duct. The cystic duct joins something here. What's this? Yes, we mentioned that there is here right hepatic duct and left hepatic duct to drain the bile from right lobe of the liver and left lobe of the liver respectively. So the right and left hepatic ducts, they unite to form common hepatic duct. Common hepatic duct unites with cystic duct to form this important duct, which is the common bile duct, or you can say bile duct. So you have two commons here: common hepatic that joins the cystic duct to form bile or common duct. So what else, guys, we have here? You can see impressions. Yes, these impressions on the vessel are created by different steps. I would like, guys, of course, I would like here to show you that, yes, starting from the left here, guys, is the gastric impression. This is an impression created by the fundus. As you see here, this is a gastric impression. Now, moving like toward the caudate lobe here, guys, is the location of esophageal. Look at this angle. Esophageal impression for esophagus, the abdominal part of esophagus. So we have gastric impression here and esophageal impression. I will show you, maybe if I have time, I will show you the on the plastic model where's how's those created. Well, simply, you know, this is the liver here, and this is the stomach, and you know, this is the esophagus, right? Right? Sorry, I'll show you on the camera. So this is the esophagus, and this is my fist, قبلة ايدي يعني للstomach, right? So لما بتطلع انت هيك, when you look at it here, you will see that yes, this is the gastric impression and this is the esophageal impression. Yes, those on the left. Now let us move to the right. Here, guys, you know that the right lobe, but here, guys, the upper pole of right kidney located here. So this is the renal impression, which is for the right, for the upper pole of right kidney. So this is the renal impression, and you know, above the upper pole of the right kidney, you have suprarenal gland. So this an impression to the right suprarenal gland. Well, I will let you. I know one case of. I know somebody who has really a tumor on the right suprarenal gland, and because of its close relationship to the inferior vena cava, it creates a kind of impression on this large vein. So always remember the close relationship of the right suprarenal gland to the inferior vena cava, and sometime in a tumor case, in case there's tumor, it creates a kind of compression on this vein. So this is renal impression, guys, and this is the impression for right suprarenal gland. What else? You know the close relationship of gallbladder to the to duodenum. So this impression is for duodenum. But most anteriorly, you know that the liver, the right lobe of the liver, rests on the transverse colon. So this is a colic impression, most anteriorly, right? Colic impression. Okay. Now, what we have, uh, what else? Yes, if you look again here, oh yeah, you have this vein. We know that is the inferior vena cava, but what about this vein? This is, you know that we have hepatic veins. That means veins that drain the blood from the liver itself to the inferior vena cava. Hepatic veins. You have right, you have middle, and you have left. So you have right and left and middle. So this is the left hepatic vein. Okay. What else? Okay, for this plastic model, let me show you guys the plastinated model. We have a nice plastinated model here. Maybe I'm sure maybe we'll ask you in the exam about it. So again, this is the inferior vena cava located posteriorly, right? And this is the, I would say, the right lobe of the liver, and this is the left lobe, divided superficially, anatomically, of course, superficially by this groove you see. This was the falciform ligament here. And you know, on the inferior border of falciform ligament, you have the round ligament of the liver. This is the round ligament of the liver, right? Or ligamentum teres. Continue, guys, at the same plane on the left sagittal plane posteriorly. You will get another fissure, which is for the ligamentum venosum. Yes. Just a moment, we are repeating the plastic model, so I'm not gonna dig deep in details. So, because the same, we don't want to repeat everything. Okay, this is the left sagittal, but the right sagittal pass through the gallbladder and the inferior vena cava. Yes, this is the gallbladder, and this is the inferior vena cava. This is the right sagittal plane connected with the left sagittal plane by transverse plane here. Let me shift the inferior vena cava a little bit here. So this is the arch shape in the Porta hepatis. Okay, so let us move the inferior vena cava now a little bit here to have a look at structures in the Porta hepatis, which is not clear like a classic model, but this is the gallbladder, fundus, body, and neck, and because it's plastinated, they are like all stick to each other. But anyway, we can say, yes, this is the cystic duct here should be. And you know the relation. Yes, most anteriorly, and the inferior vena cava posteriorly. The gallbladder always anterior, right? Anyway, so we have the right, which is not clear here, right and left hepatic duct united to form common bile duct, united with cystic duct to form the bile or common bile duct that you see here. This is the common bile duct, right? So we'll show you where's the opening of the common bile duct in the duodenum. Anyway, so posterior to the biliary system here, guys, you have the right and left hepatic arteries, but we cannot see here because of plastic model, but you can see this vein, which is the portal vein, most posteriorly, right? Yes, it's clear here, but let me show you here first. Not clear here. Yes. You see this again. I forgot to mention that, which is not that much important, but I would like you guys to know. This is posteriorly the caudate lobe. Caudate lobe had two processes. One toward the Porta hepatis. This is a process which is like a nipple shape. So this is the papillary process. بروز يعني مثل شكل حلمة. Papillary process of caudate lobe. But it has another process toward the right lobe, which is known as caudate process. So you have papillary process and caudate process that connects the caudate to the right lobe of the liver. Let me show you in the plastic model where they are. Yes, posteriorly, yes. You know, it's the inferior vena cava, and this is the fissure for ligamentum venosum. In between, you have posteriorly the caudate lobe. Caudate lobe has two processes, one toward the Porta hepatis known as papillary process, and another process toward the right lobe of the liver. This is a process that known as caudate process, right? Yes. So yes, we have here a couple of impressions. Again, I would iterate what I mentioned on the show you the impressions as I showed you in the plastic model. Here is, guys, the gastric impression, and most posteriorly here the esophageal impression. Move to the right, and here, guys, the I would say the renal impression. Medially and posterior to it is the supra impression for suprarenal gland. So this is renal impression, and this is impression for right suprarenal gland, very close to the inferior vena cava, guys. But here, guys, this is the gallbladder. Yes, there is an impression for the gallbladder if you remove it, which is not covered by peritoneum. And this is also impression for inferior vena cava, you see here, which is easy. But again, just to the right here, you see the impression for duodenum, because you know the close relationship of first and second part of a duodenum to the gallbladder. And most anteriorly, you have the impression for the colic impression for transverse colon. Yes. Here, guys, another plastinated model, which is very nice. Here's the inferior vena cava, guys. You see here posteriorly, that means it's the gallbladder anteriorly. So look at the gallbladder here. Look at the neck and cystic duct, which is very clear. Let me remove the portal vein that's located posteriorly. So look at the gallbladder, neck, and cystic duct, and look at the cystic duct that joins the common. I would like to show you here. Sorry. Just a second. Okay. I'm trying just to remove the portal vein, right? Just to pull it back. So cystic duct that joins the common hepatic duct. Of course, this is the bile duct. This small part you see is the bile duct, because you know that the cystic duct joins the common hepatic duct here, right? Which is not clear. Oh yeah, this is very interesting here. Okay, this is the, I would put this prop here in the inferior vena cava to remember that. So this is posteriorly. And look at the falciform ligament. This is the remnant of falciform ligament. Very nice. Look at the falciform ligament that divides superficially the liver into right lobe and left lobe. And which, of course, if it's a double layer of peritoneum. And look at the inferior border of it. You have a ligament here, round ligament of the liver. And here, guys, look at the peritoneum that covers almost of the diaphragmatic surface of the liver. But at this region here, guys, you see, I'm trying to show you. At this region here, guys, it's reflected. You see how it's reflected here? So this is the anterior layer of coronary ligament, anterior layer of coronary ligament. And here is the, should be the posterior layer, which is not clear here. So this is anterior layer here, posterior layer here. So this area not covered by, this is the bare area of the liver. So both the anterior layer and posterior layer of coronary ligament, they unite to form triangular ligament on the left and triangular ligament on the right. So yes, this is the fundus of gallbladder projected anteriorly, that's in contact with the anterior abdominal wall. Okay. Lastly, guys, important to show the biliary system. Okay, guys, here again the cross section, I would say frontal section of the liver. Look at the right lobe and left lobe. Look at the inferior vena cava. Look at the right hepatic vein. And look at it here, guys. You see like a combination of vein, which is portal vein, branch of hepatic artery, and the branch, of course, should be here, branch from bile duct. This is the portal triad. Portal triad inside the liver. You can revise or read again the histology of the liver. Okay, look at the porta hepatis here. Right hepatic. Of course, the relation is not correct. So you have to know that the relation here, guys, at the porta hepatis is not correct. Anyway, this is the right hepatic duct, and this is the left hepatic duct. They unite to form common hepatic duct. Common hepatic ducts with cystic duct, they form common bile duct. Common bile duct. So this is the gallbladder. Look at the internal surface of the gallbladder. It's like honeycomb shape because of the folding of mucosa inside it. So this is the fundus, body, neck, and this is the cystic duct. Look at the valve here, which is like mucosal fold in the cystic duct, and this is the smooth part of it anyway. So look at the relation of the gallbladder to the visceral surface of the liver. Notice here, guys, another structure which is the here the portal vein, the right branch and left branch of portal vein that drains the blood from most of GI system. And guys, you have hepatic artery proper here that divides into right hepatic branch and left hepatic branch. So what else? Look at the relation of the stomach to the visceral surface of the liver here. So guys, what else here? I would say nothing that much, but let me finish the biliary system here. And here, guys, the common bile duct that opens in the posterior medial surface of the second part, halfway of the second part of a duodenum, right? The major duodenal papilla here, halfway of the second part, guys, on the posterior medial wall. Anyway, here is another structure. I will talk about it when I will start talk about the pancreas. So let us shift now, talk about the pancreas. Although this is not a good model, I will choose another model, but I will be back to talk about it. But let me show you here, guys. Great model for the biliary system and porta hepatis. Look at the cystic duct that unites the common hepatic duct to form the common bile duct, or you can say bile duct, that passes in a groove behind the head of the pancreas, and then it penetrates its substance to joins the main pancreatic duct to form this ampulla. This is hepatopancreatic ampulla, or you can say ampulla of water. Ampulla of water. So that opens into major duodenal papilla, as I mentioned earlier. So that means this is the pancreas. This is the head of the pancreas. We divide it in order just to make it easier to study it. So you have the head, and you have constricted part here, which is the neck. And between the body, between the head, sorry, and body, you have neck. That means this is head, neck, and body, plus the tail of the pancreas, which is very important. We'll talk about it in the after a couple of minutes. So look at the head, guys, which is related to the common bile ducts here, guys. And you would see here, guys, the inside the head of the pancreas, located in the concavity shape of the duodenum. This is the duodenum, first, second, third, and fourth part. So this is the concavity, the C concavity shape of the duodenum. So the head of pancreas located there. And look at the main pancreatic duct here, in which it passes all the way from the tail, body, neck, until it reaches the head. Then it tilts or moved downward, and then it joins the bile duct to form hepatopancreatic ampulla. Hepatopancreatic ampulla. Yes, you have another accessory pancreatic duct here. If you move from the from where it opens, guys, it opens into the not major papillary, major duodenal papilla. No, it's open into the minor duodenal papilla, just above the major one. So if you move from the minor duodenal papilla, you will find that the accessory pancreatic duct divides into left part, small part here, and the other part downward to drain from the uncinate process. Yes, what's the uncinate process? This is process, which is a small process projected from the head to the left. This is the head of the pancreas toward the left. This is the uncinate process. So this is here the uncinate process of the pancreas. So you have another part: head, neck, body, tail, and uncinate process. So guys, the neck of the pancreas is very important, but before that, you know that the head of the pancreas related posteriorly to the common bile duct and the inferior vena cava, and so located in the concavity of duodenum. And the neck of the pancreas is important because behind the neck of pancreas, you will find that the superior mesenteric vein. Look at the superior mesenteric vein and artery. Those superior mesenteric vessels located anterior to the uncinate process. You remember this process? Yes, here we go. So they are located anterior to the uncinate process. But you know that the head of the pancreas located to the right of superior mesenteric vein. So the head of pancreas here located anterior to the common bile duct and inferior vena cava, laterally related to the C concavity shape of the duodenum, and the head of pancreas located to the right of superior mesenteric vein. Anyway, back to the neck, guys. Here, the neck, if you remove the neck, you will find that the superior mesenteric vein united with splenic vein. Look at this vein that comes from the spleen. So they are united here. The splenic vein unites the superior mesenteric vein to form the portal vein. So this is the portal vein, or hepatic portal vein. So the portal vein formed by union of superior mesenteric vein with splenic vein behind the neck of the pancreas to form the portal vein. Excellent. So let us shift a little bit. Of course, you know, moving to the left, you will get the body of the pancreas and the tail. So the body of the pancreas, look at the upper border of it. There is an tertius artery, معرج يعني, passes at its upper border. This is the splenic artery, which is a branch of celiac trunk. So this is the splenic artery, and it passes at the upper border of pancreas. But behind the pancreas, you will get behind the tail and body, of course, you have the splenic vein. So look at the splenic vein behind it, but at the upper border is the splenic artery. Okay, guys. The body, of course, not just located to the splenic artery and vein, but also to the aorta and the origin of superior mesenteric artery, and it's related to the what you can say here, the left kidney and left renal vessels here, guys. Okay, now to the tail. The tail is important because it's inserted. Look at the peritoneum here. Look at this ligament here, guys, at the hilum of spleen. This is the spleen. The spleen connected to the stomach by gastrosplenic ligament. Forget that. You have another ligament here, guys, which is the ligament that connects the spleen not to stomach, but to the left kidney. It's known as splenorenal ligament, in which the tail of the pancreas and splenic vessels pass through there. So the tail of the pancreas and these vessels, splenic vessels, pass inside the splenorenal ligament. So in case of splenectomy, when they remove the spleen, the tail of the pancreas at more risk for injury. That means you have to expect that secretions from the tail of the pancreas can be drained out into the abdominal cavity and causes serious complications. So you have to take care. So what else? I think let me shift to another model here. I hope I didn't forget anything, but again, you can see here the main pancreatic duct, accessory one, the main pancreatic duct united with the bile duct to form hepatopancreatic ampulla, and the hepatopancreatic ampulla open to major duodenal papilla. But I would like to say that 70% of accessory pancreatic ducts open separately in the minor duodenal papilla, but 30% the accessory pancreatic duct unites with the major one and drains here into the major one. Yes, to the maybe blood supply also here. No, not shown here because I like this model. So look at the blood supply of the pancreas. If you know the blood supply to the duodenum, it's going to be very easy to know the blood supply of the pancreas. Well, it's easier to divide it into blood supply to the head and to the next to the rest of the pancreas. So similar to the blood supply to the duodenum here, guys, the head of the pancreas gets its blood supply from celiac trunk and superior mesenteric artery. So you know the gastroduodenal artery that divides into to anterior and posterior pancreaticoduodenal artery. So you have superior pancreaticoduodenal. But what about the inferior pancreaticoduodenal? Inferior pancreaticoduodenal from the superior mesenteric artery. They anastomose here lateral to between the head and the duodenum. And guys, because of the the relationship of the head of pancreas to the duodenum and the anastomosis of blood supply and bile duct. So it makes it difficult to remove the whole head of the pancreas during pancreatectomy. So when they remove the pancreas, they cannot remove totally the head of the pancreas. Still, there will be remnant there because of the reasons that I mentioned. So look at the rest of the pancreas, which is supplied by splenic artery. Splenic artery passes at the upper border of it, and it gives here nearby the neck the dorsal pancreatic artery. Not just dorsal here, but you have nearby the tail. You have the greater pancreatic. So you have dorsal here, pancreatic here. But the dorsal pancreatic artery, guys, gives the inferior pancreatic, passes at the lower border of the pancreas. So you have dorsal, greater, and from dorsal you have inferior pancreatic artery. Okay, guys. So you have this model here, not that much to say about it, but I would like to show you, maybe it's good for the exam or so. Well, I would say that's it for the liver and pancreas, but let me show you, if we have a plastic model, to show you the relation of the liver. So here, guys, you know, this is the plastic model for the, I would say, for the abdomen now. Look at the diaphragm that separates the thoracic cavity above from abdominal cavity below, and this is the liver, and this is the region for falciform ligament that superficially divides the liver into right lobe and left lobe. And here's the fundus of gallbladder projected against the anterior abdominal wall. Just as a quick, very quick revision, just to show you the location of it, that occupies the right hypochondrium, epigastric, and extended to the left hypochondrium. Look at the left lobe here. So this is its relation to the fundus of gallbladder here. So, and let me show you slowly, guys. Look at the stomach, and this is the abdominal part of esophagus. This is the abdominal part of esophagus. So look at it, it's most posteriorly. So it's located here. If we flip the liver here, so the liver is like that, right, guys? So let us flip it like this, slowly. Look, so here's the impression for esophagus. Here's the impression for esophagus, close to the inferior vena cava. That's why, because it's located like that, right? And again, this is the gastric impression. So this is the gastric impression, and here posteriorly is the esophageal impression. You know why? Because it's like that. So what else here, guys? Look, most anteriorly here, the right lobe. Here is the inferior margin, yes, of the liver, but anyway, here's on the right. The most anteriorly here is the colic impression, close to the gallbladder to the right. This is colic impression against the transverse column. What we have here also, guys, the duodenal impression here, because this is the duodenum. And look at the upper pole of right kidney, and most medially the right suprarenal gland. Look at it here. You just imagine that, guys. This one will be here. So let me shift it back again. Let me shift it back a little bit. So yes, this is most posteriorly, because of the inferior vena cava. This is the kidney. So this is the kidney, renal impression, and toward this, I mean, this is the kidney, this is the right suprarenal gland. Yes, this is the impression for right suprarenal gland. So this is the inferior vena cava, yes, because this is the inferior vena cava, right? I don't know if you can see it. Yes. This is the right superior gland, most posteriorly. So, yes, this is, I would say, everything for liver and pancreas. Please, if you have any question, please don't hesitate to ask me. Thank you.